Hello, and welcome to this talk from the Yale Child Study Center Program for Anxiety Disorders. And in this talk, we'll look at the way that a child's anxiety might impact the family system and at some strategies for parents to support their child in overcoming anxiety and facing their fears. It's no surprise that parents of children who experience a lot of anxiety become drawn into the child's difficulty, because after all, people are mammals, and young mammals rely on their parents for both protection and reassurance when they experience anxiety. One helpful way to think of the way a child's anxiety might affect the family dynamic is to think of anxiety as blurring the boundaries between parent and child. For example, parents and children occupy different space, indicating them being two separate individuals, such as when a parent is at work and a child is at school, or when a parent sleeps in one room and a child sleeps in another. But when a child is overly anxious, that space might go away, as when the child needs to be in the same room as the parent all the time, or when a child wants to sleep in the parent's bed. Parents can ask themselves questions such as, are my actions a reflection of my beliefs and goals as an individual and a parent, or am I engaging in actions because of the need to alleviate my child's anxiety? For example, parents of children with obsessive-compulsive disorder often find themselves performing compulsive rituals because otherwise the child feels anxious. For example, repeatedly checking locks on doors because otherwise the child is too afraid to go to sleep. Parents can ask themselves whether their time is managed by themselves or by the child's anxiety disorder, as when a mom needs to take multiple phone calls over the course of the day from an anxious child, or when parents devote endless time to answering reassurance-seeking questions. Even emotions can become entangled between parent and child when a child suffers from an anxiety disorder, so that parents feel swept away by the child's anxiety and reflect their own fear back to the child. In one example, a 7-year-old girl was repeatedly taken to the emergency room at night by her parents because of difficulty breathing stemming from anxiety. Although doctors reassured the parents that the child was physically quite healthy, they were unable to withstand the anxiety of seeing their daughter struggling to breathe. And of course, the child's anxiety was tremendously heightened by the experience of being rushed to the hospital at night. Parents of children with anxiety disorders will often face many dilemmas and ask themselves questions such as, should I give in to this anxiety, or should I demand that my child cope better? Is this real anxiety, or are these just reassurance or attention-seeking behaviors? Is my child just misbehaving? Or even questions such as, who am I allowed to tell about my child's anxiety? In trying to help parents better support their children, it's helpful to address some common misconceptions or traps that parents fall into because of their children's anxiety. And although these misconceptions seem to make sense or appeal to intuition, they can be significant roadblocks to a parent's ability to support their child in overcoming anxiety. One such idea is the thought that anxiety is a dangerous and damaging emotion, and that it's the role of parents to protect their children from experiencing anxiety. In fact, not only is this factually incorrect, as anxiety is a normal and healthy phenomenon which children are well equipped to experience, it's also a very problematic message to the child. It's as if parents are saying to the child, you're not able to cope with anxiety, and so I have to protect you. A child who comes to believe that they're not able to cope with anxiety is almost assured of continuing to suffer from an anxiety disorder until the attitude changes. And so rather, parents should be striving to convey to the child the message, you are able to cope with anxiety. I'm sure that you can deal with this, and I'm going to help you to overcome this problem. Another parental trap that parents will often fall into is the idea that the child's anxiety needs to be kept secret from anyone outside of the immediate nuclear family. In fact, many adults who suffered from anxiety in childhood describe someone outside of the home as being most helpful to them in overcoming their fears. Grandparents, uncles, aunts, neighbors, and counselors can all be tremendous sources of support to both parent and child if they're allowed in and allowed to speak with the child about the anxiety and offer help and support. Another misconception that can be a real trap to parenting an anxious child is the thought, if I acknowledge that my child is really afraid, then I can't ask them to overcome that fear. It's really easy to fall into the trap of insisting you're not really afraid or it's not really frightening, but a child is likely to experience this as a kind of misunderstanding or even abandonment, because it's as if we're saying to the child, I don't believe that you feel what you feel. But the child internally knows that they are really afraid, and so rather than being supported, they're likely to feel more alone and less hopeful about overcoming the fear. So it's more helpful to convey to the child the message, I know that you are afraid, but I believe you can overcome this. This is the stance that we attempt to help parents to adopt with regard to their child's anxiety, a stance of support. In other words, combining the idea of acknowledgement and empathy for the child's inner experience of fear and anxiety, combining it with a belief and a true confidence in the child's ability to withstand anxiety, and some gradual expectations for increased coping. Sometimes, one of the most difficult aspects of parenting a child with an anxiety disorder is identifying and reducing all those ways in which parents are accommodating to the child's anxiety disorder. This could be through changes to the parent's routines and timetables. It could be through providing reassurance, or it could be through doing for the child things that they would otherwise be expected to do for themselves. For example, a child with social anxiety disorder might be reluctant to speak to someone else, and their parents might have become accustomed to speak for them. Or parents of a child with obsessive compulsive disorder might feel that they need to engage in rituals such as washing their hands repeatedly before serving food, because they know that otherwise the child becomes very agitated and will sometimes even refuse to eat the food that's served. This can obviously be very distressing to parents, but we know from a lot of research into childhood anxiety disorders that as long as parents continue to accommodate the child's anxiety disorder, the likelihood of that child overcoming the disorder is quite dramatically reduced. Another difficult aspect of parenting a child with an anxiety disorder is the strain that the child's anxiety can place on the parent's ability to act cooperatively and collaboratively between themselves. Any number of factors can contribute to this difficulty. For example, parents often have different expectations of the child. One parent might think that not going to Boy Scouts or sleepovers is a sign of disorder, while another parent might feel that that's a legitimate choice on the part of a child, and this could lead to conflict. Sometimes the different amounts of time that the two parents spend with the child can contribute to their different feelings about the child's situation, such as when one parent only comes home after the child is already in bed, while another one has spent hours reassuring the child or having to accommodate to their anxiety disorder. Sometimes differences in attitudes toward child rearing can cause conflict, as when one parent is more authoritarian and believes that strict demands should be placed on the child, while another one is more democratic and thinks that the child should be allowed greater leeway and more freedom in choosing how to conduct their own life. All of these and many other factors can contribute to the difficulty in working together. Sometimes conflict becomes so pronounced that each parent sees the other as actually damaging to the process, rather than as helping the child to overcome the fear. But as we've seen, support for an anxious child actually means combining two very different attitudes, combining acknowledgement, empathy, and acceptance of the experience with gradual demands for coping and with a confidence in the child's ability to withstand anxiety. And so more often than not, although parents might significantly disagree, both of them are standing for an important aspect of support for the child, which is quite necessary in helping the child to overcome anxiety. Recognizing this and coming to see the other parent as reflecting an important aspect of support rather than as damaging to the process can greatly help parents in collaborating around the child's anxiety. Increasing communication about the child's anxiety can also be an important tool for increasing cooperation. Unfortunately, many parents will only talk about their disagreement or about the child's anxiety in the moment when the child is experiencing anxiety and they're under tremendous stress. But this is unlikely to lead to productive communication. Setting aside a special time to talk about the child's anxiety and to discuss strategies for better helping them to overcome the fear can be an important part in increasing cooperation. Additionally, we sometimes encourage parents to trade roles, just briefly, sometimes for a few hours or one day, so that the parent who has been in charge of reassurance and empathy takes on the responsibility for helping the child to overcome fear and takes on the role of greater expectations from the child, whereas the parent who has been completely responsible for demands and for coping now finds himself responsible only for reassuring and comforting the child when anxious. This can help parents to see the value in the other parent's point of view and to decrease conflict and increase collaboration. And so childhood anxiety disorders can place significant strain on a family system, but parents are often able to support their child and help them in overcoming fear and growing healthier and more able to focus on other adaptive and important aspects of growing up. Thank you.